Simon, thanks so much indeed for taking time out of your Sunday to speak to us. What do you make of the New York Times reporting about this illness that the one patient had been suffering after taking part in the trials?
Well, it's my understanding too that that's what this person who was taking part in the trial, went down with. It's perfectly normal for these things to happen during vaccine trials, and it's a sign of good vigilance, of good process on behalf of the trial managers. So it's entirely normal, this sort of thing, and really not anything to worry about. These things happen.
What is the main thing to look out for in terms of the phase 3 trials? Are we talking about the number of people that are taking part, or are we talking about the amount of time after they've been given the dosage of the potential vaccine? What are the most important things to look out for in terms of the safety, and when the scientists may be happy that, okay, things are going exactly the way they can because of what's been happening over the course of the trial?
Well, there are a number of things they'll want to look at. Perhaps the most important one, well, the two most important ones are: does it work? Does it prevent people picking up an infection, this coronavirus infection? The other one is it safe? And there are always often safety concerns around vaccines. That is not unusual. And of course, then we have to ask the question: if it protects people against the virus, how long does it last for? It's all very well if it only lasts for a month or so. That won't be very useful. We want it to last for years, and we want it, if possible, to protect against carriage and the worst elements of the infection. So there are a number of things that need to be looked at. And of course, the time issue can only be looked at over time. We can't know whether any vaccine will protect people for a year, 18 months, 2 years in a matter of months. That's just not possible.
Yeah, absolutely. That time issue is particularly interesting because, of course,
Indeed.
usually these phase 3 trials, they take years, don't they?
Yes,
you're
they
a
do.
scientist, and many people who don't understand the science are relying on hope. Leave the hope to one side and give us the hard facts in terms of the science. How do you feel about the possibility of a vaccine even ever being discovered?
Well, a lot of effort is being put into this before, but having said that, there has never been there has never been any clinically useful vaccine against coronavirus. People have tried and failed. So it's not a given that it will work. And we see, frankly, in the UK at least, some rather overexcited commentary about the UK vaccine programs, and you probably see it in other countries about theirs as well. And we've seen predictions that our vaccine trials will work. People don't know that. They go on news programs and say, "Oh, I think it'll work." They've got no idea. Those trials are blind. Nobody knows what's going on in them. And really, people shouldn't be saying it, and certain journalists shouldn't be lapping it up quite so quickly.
Simon, thank you so much indeed. Simon Clarke from the
welcome.
University of Reading.